As we are aware, air quality index in Delhi versus air quality index in Kerala or Bangalore, there is a huge amount of difference. 147 to 91 is the air quality levels in Karnataka, Bangalore, Kerala, as opposed to 312 to 350 on an average happening currently in Delhi. That is the magnitude of air pollution. It is over the hazard area. So anything more than 300 is not a good thing in general. So the health effects of air pollution has been very well documented. In fact, scientists have looked at the rising level of pollution and correlated that with respect to number of deaths at that time, all-cause mortality. And some of them have been specifically looked at as a direct event of air pollution. 7 million deaths on an annual worldwide basis is due to the air pollution. So in that, what we do for simplicity is divide the health effects of air pollution into three groups. Immediate, that is what we see immediately, short term, few days to weeks, and long term. Immediate things that we see is a increase in allergic rhinitis, worsening of asthma, worsening of COPD or smoking related breathing difficulty issues, conjunctivitis, increase in lower respiratory tract infections. These are immediate ones. The short-term ones include neonatal disorders, kids that are born during this particular time, vascular problems, heart attacks and cardiac related events, and economic downside of the air pollution. These are intermediate effects. And the long-term effects of air pollution include cataract and lung cancer and other medical issues. So virtually every organ in the body is affected due to health effects of air pollution. Due to this increasing dangerous air quality index and increasing pollution, what we are seeing is increased number of patients getting admitted with asthma exacerbation. If not admission, their requirement of medications is going up. People are reporting skin irritation, conjunctivitis, and a general sense of suffocation. These are very commonly seen in Delhi at this point of time. The number of cardiac events, there is no yet definite data, but I think it is increasing marginally. Each individual in Delhi currently has a great responsibility, and each one can contribute to reduction of the air quality index, improve the air quality index. And how? Just let us look. Industrial combustion will lead to 39% of the current problem. Transport will lead to 4% of the problem. Therefore, the simple things are mask up Delhi. When you say mask up, I think the good N95 mask with which the habit that we inculcated from the COVID times will stand as good. Prefer indoors rather than going out. If you have to go out, ask a simple question: do I need to take my vehicle? Can I avoid? That is much more a practical oriented question, shouldered with a sense of patriotism and responsibility. Look for venues to get your flu shot done. Flu vaccination is very important. It will reduce the amount of flu in such a polluted circumstances. Special attention to taking your asthma medication, do not reduce the inhalers, do not reduce what is prescribed medication for you. People with COPD and people who smoke definitely need to stop smoking cessation. This will contribute not only to your individual health but to the general health of Delhi. Indoor exercises to be preferred more, and if the AQI increases more than 340, keep the windows and indoor shut. Even though there is limited evidence with the use of air purifiers, certainly they may come in handy at times. So if you have an air purifier or you can afford one, this is the time to get one. But make Delhi greener is another thing that should be started much before every annual peak incidence of the air pollution. So number of things that each individual can do, and we can all jointly contribute to the reduction of air pollution at an individual level.